Hi, my name is Jane Powell. Welcome to Community Connections, brought to you by the Greater Kanawha Valley Foundation. This is a show showcasing community involvement, and today I have a great guest, and we're going to learn so much about public health. My guest is Dr. Sherri Young. She is with the Kanawha County, or the Kanawha-Charleston Health Department, and Executive Director, Health Officer. And let me get this right. Sherri Young, you are a DO, an FAAFP, which is a National Fellow of the Academy of American Family Physicians?
That's correct.
Wow, okay.
Thank you.
And other credentials that you have are President of the West Virginia State Medical Association.
Yes.
And President of the West Virginia Academy of Family Physicians Association. Is that right?
Yes, that's correct. Thank you.
So, thank you so much for being here. You're a busy lady.
I fill my days, but it's my pleasure to be here. Thank you so much for having me.
Thanks. So today we're really going to talk a lot about your role with the Kanawha-Charleston Health Department and things that you're doing there. And I know it all intertwines. Your calendars, you're juggling all these hats. But with the Kanawha-Charleston Health Department, you're doing some great programs and a lot of outreach. And I think that is just really wonderful things for us to talk about and to share.
Well, thank you. Thank you. I'm very happy to be here, and I'm so happy to talk about everything that we've been doing at Kanawha-Charleston. And so when I took this job, one of the promises I made was to get out into the communities, and the Greater Kanawha Valley Foundation has helped us do that. As you know, we are in the middle of an opioid epidemic, and we are fighting some very serious infectious diseases because of the epidemic. We are looking at HIV and Hep C and how we connect to people to get them into care, and identifying these people that are at risk, and hopefully getting them into treatment before it becomes an infectious disease issue, but also identifying people who may have already contracted the diseases and getting them into care. And so thank you to the foundation so much for allowing us to get out into these communities to do some of that outreach.
So not only is that outreach helping prevent spreading of it, it is helping the quality of life of the patient.
Absolutely. And so something I really want people to know is that when we talk about HIV is very different than what we had 10 years ago. We have several advances in medicine that now you can take a daily medication. It's not the complicated medications that used to make people sick, and several times a day having to remember to take medications. The medications for HIV, so much better than what we used to have, and very effective. We have found that now if somebody has contracted HIV, as long as they are connected to care early, that they can have almost a normal lifespan, living into their late 60s, early 70s, as their lifespan would typically be. And so that is very, very important for people to know, not to fear HIV.
So that's very different than maybe the image that we have from movies or from television.
Yes.
Of the HIV patient.
Yes, the vision of the HIV patient has changed so much in the past few decades. And there's something else that I really want to get out for people to know as well. There's prevention out there called PrEP therapy. And what that is a daily medication that you can take that if you are at risk for any reason of HIV, that of using IV drugs, that of high-risk behaviors, outside of that, you can be on a medication you take once a day that is highly effective, between 75 to 95% effective in preventing HIV as well.
Wow, I did not know that.
Yeah, it's a wonderful thing. We are going to try to build that capacity to get that to people from the health department. We already have partners at Health Rights and Covenant House, as well as the Ryan White program, who are prescribing this in our area. So we are all hands on deck trying to fight this HIV.
That's great. I love that you're working with all the different groups throughout the county.
Yes,
to try to stop and prevent spread and people getting worse. That's wonderful. And so I guess maybe that brings, your office in the Charleston Clinic is right in downtown Charleston.
Yes, we are across from the Marriott and across from the Civic Center. And so we are still in the same location. We are open 8 to 4 Monday through Friday. And we have in the past few months made an effort to be open on a few Saturdays as well as on a few holidays so that people who may otherwise be working can have access to our services, including immunizations.
So that's for the person that can be downtown, can get downtown and has access to that. But you're also doing some community outreach in other parts of the county, is that right?
Absolutely. So thanks to the grant that we've been working with, we've been able to do HIV and hepatitis C outreach to at-risk people in several communities. For starting in St. Albans, we were able to test 38 individuals, and not only do that, but partner with the University of Charleston pharmacy program to provide naloxone training. Naloxone is a life-saving medication for people who may be having an opioid overdose. And so we're not just going in the medical capacity, we're going in the prevention capacity and educating people as well as getting them into treatment and really just getting to know them. In addition to St. Albans, we've reached out to Boone County, which was a little lower turnout, but still happy to do that. We've been to Booker T. Washington Community Center in London, West Virginia, which are wonderful, wonderful people there. And most recently, we did an HIV outreach event where we tested and connected to 53 people at a recovery unit.
Wow.
And that has been that is my best day at work, I have to say, is that not being behind a desk, but being out there testing for HIV, talking about risk factors, and the people that were in the recovery community, hearing their stories, hearing where they had gone, how they had come back from so much adversity to come back to now be in recovery and having jobs and responsibilities. And it was just amazing to get to see them face to face.
So I'm going to put you on the spot just a little bit, but this is always one of my favorite things to hear. Can you think of someone that you worked with or a story that you heard that you could share?
So I have met so many wonderful people in the community as well as community leaders through the outreach that we've been doing. But probably my favorite story so far is a gentleman that I met who had been incarcerated due to having his life just completely disrupted by the opioid epidemic. And he learned to express himself through tattoo and through body art. And he is now in recovery, and his job is going to be working at a tattoo place where he can help other people with their expression. And so to see him go from deep in the throes of an opioid addiction to building his life back, to have a creative outlet at the end of that, it's just wonderful. But there are so many wonderful people that we've met, so many community leaders. I've got to meet with mayors all across Kanawha County, and most recently I had met with the mayor of Marmet, which we have something wonderful coming out of that meeting.
That's right. So tell us about what's happened, because I believe that your event in Marmet is just one of hopefully many that will happen in the future.
Yes, so we will be having a community health fair on April 3rd at the community center in Marmet.
Okay.
And so early in my tenure, I was able to put together a health fair at the health department, and it was wonderful. But I want to be able to pick that up and take that out, and so everybody in the communities can be involved and have access to free medical advice, free medical care. So as I was saying, I had a great sit down with the mayor of Marmet. I wanted to come in and do some community outreach, HIV testing, Hep C testing, general medical testing, naloxone training, and it was so wonderful because he was so energetic in the fact that he wanted to bring in vaccinations for animals. And yes, and so we're bringing in wonderful partners. We're bringing in the American Red Cross. We're hoping, we haven't got confirmation, but we're hoping that the County Sheriff's Office will be able to provide drug take-back. If not, we will have those services available through another entity. But we are really going to put together a wonderful product to highlight the healthcare in Marmet and to show our presence there and to support them, because it's just a wonderful, wonderful thing we'll be able to do.
So that is happening on April 3rd.
Yes.
At the Marmet Recreation Center.
Yes.
I love that you're doing it in their community, because I think people are more open and receptive when you come to them.
Yes, and that's something that I truly want to do. I've been in the position about 7 months, so I haven't had a chance to do this in every community, but I am hoping that you will see us having a presence in other areas in the coming years so that we can bring those opportunities to everyone.
Yeah, I like that a lot.
Thank you.
And I guess this time of year, any time of year, but particularly now, we should talk about flu shots.
Absolutely. We should always be talking about
That's
flu
right.
shots. Yes.
I get my flu shot every year and
Wonderful.
have for as long as I can remember.
Very good, very good. And the flu shot offers so much protection. We're seeing this year that is about 50% effective. We're completely reducing your risk of having the flu at all. But people forget that even if they do become ill with influenza-like symptoms, it does still decrease that time of being sick, the time off from work, and the transmission of disease. So the flu shot is so much more than just protecting your individual self as far as the spread of flu.
And I'll say for me, I have never gotten sick from the flu shot. You know, I think that's always kind of a myth that the flu shot will make you sick.
Right.
I have not had that experience.
Well, I can tell you from my clinical practice days that people would say that they would get sick from the flu shot. And it is typical because your body is mounting an immune response. There's no way for you to get the flu from the flu shot because it's not a live virus. So it cannot come back and make you sick. However, it is common to have a little low-grade fever, muscle aches, or just kind of feel like you have a cold for a day or two. And that's what your body is building that immunity. And so that's what your body is supposed to do from the flu shot. So that's perfectly normal, but it is not getting the flu. Flu is 3 or 4 days of nausea, vomiting, diarrhea, cough, congestion, fevers of 101 to 102 degrees. It's just, it's a severe.
It's nasty.
It's nasty. So it's so much easier to get that flu shot to prevent it.
Yeah, it sure is. Good, doesn't hurt.
Absolutely.
Yeah, a little minute and it's over. So we've talked a lot about your outreach and the flu shots, and you did mention that you're kind of well into your first year on the job, and I know one of your goals is to continue the community outreach.
Absolutely. And so the flu shot is one of those initiatives. Thank you to the Kanawha County Commission for restoring some of our funding, which we are going to take and get 5,000 more flu shots out into the community for this year.
Wow.
This coming year. And so we've been able to get into the community and we've been providing flu shots free of charge the last several months. But we're seeing an evolution in healthcare. We see more hospitals closing, which decreases access. We're seeing people with higher deductibles on their insurance. So we want to remove any and all barriers to getting the flu shot. We will still be going to county schools and private schools around the county to provide flu shots to students and still doing community outreach to businesses. But we will have more free flu shots coming for the next flu season to protect our community.
Wow. So it's not too late to get a flu shot?
No.
Is there an ideal time or a time that we should mark our calendars to get flu shots?
Absolutely. So there's never a point where it's too late to get a flu shot, but you want to try to get that flu shot before flu activity occurs. So somewhere on the calendar between September and October, it takes 2 weeks for you to build immunity. And what we typically see, we'll start seeing a little bit of influenza in November, and typically we'll see 2 peaks. We'll see a peak around the end of December, and then another peak around February, which is exactly what we saw this year. Very typical flu trends. But we can see influenza into the summer months. So if you have not had your flu shot, we are happy to provide that for you at the
Okay. And I know that any information people wanted to learn about the Kanawha-Charleston Health Department, they could find that on your website.
Yes.
And that that address is on our screen, but it is kchdwv.org. And I know they can find anything that they would want to, all the information and upcoming events.
Yes.
Dr. Young, thank you so much for joining us today.
Thank you for having me. It's been a pleasure.
I've loved learning about the outreach, and I look forward to hearing more wonderful things.
Thank you. I hope to see you in Marmette.
There you go. Thank
Awesome.
you. Thank you guys for joining us. This has been Community Connections, brought to you by the Greater Kanawha Valley Foundation. We'll see you next time.